Folks are coming in now from the lobby. Give it another 30 seconds or so, as there are folks still logging onto the meeting. All right. It looks like most folks are in now. Thank you, Rocky, for continuing to admit folks into the meeting, but we'll go ahead and get started. Before I get started, I did want to note for all of the attendees that this webinar is being recorded. If you're not okay with this, feel free to hop off the call now. At this time, all audience members' mics are placed on mute and videos are disabled. Good afternoon. My name is Alexia Rodriguez. I am a public health analyst, a policy partnerships and recruitment office in our CDC Division of Workforce Development. Thank you for joining us for this webinar. We have a very excited group here to talk to you about their experience in CDC's Epidemic Intelligence Service, so what it's really like to be a disease detective with CDC's EIS program. Over the course of this webinar, you'll hear a brief overview of our EIS program and then meet these three EIS officers to hear again about their experience. We do have time dedicated towards the end, the latter half of the webinar, dedicated for audience Q&A. Our time is limited, so we do ask that your questions be tailored to our panelists' personal experience in the program. You can ask these questions by typing them into the Q&A of the webinar. So the chat is disabled, but you should be able to type into the Q&A your questions. And we'll go through those once we get to the Q&A portion. Please note that questions about application requirement, eligibility, logistic timelines, and other program-specific questions can be answered either by visiting our website, which we'll put in the chat for y'all, or questions can also be sent to our mailbox that will also be in the chat. So now, without further ado, I will hand it over to Dr. Eric Pesner, Branch Chief of the Epidemiology and Laboratory Workforce Branch and EIS alum, to give us this overview of the EIS program. Over to you, Eric.
Thanks, Alexia, and welcome everybody. Good morning, or good evening, or good afternoon, depending wherever you might be in the world. Thanks for taking the time to join us today. Again, I am chief of the program, but I'm also an alum. I was an EIS officer in 2005, and now I'm very fortunate to get to work with the program. So this is CDC's Disease Detective Training Program, and we're going to give you, again, as Alexia said, some oversight. And then we're going to spend the bulk of the time letting you hear from some of our current officers. So next slide, please. So if you think about any major public health event since 1951, when this program established, and EIS was probably there, whether it was their involvement back in 1966 or on the left side of this figure, smallpox eradication, jumping to 1976 and Ebola in what was then Zaire, and then leaping forward all the way back to the middle of the figure, 2003, the SARS response, jumping even further towards the right, 2019 EVALI outbreak, and most recently in 2022 on our figure, we have Mpox. So if there was something big, scary, concerning happening, EIS was there. Next slide. Now, EIS is the world's longest running field epidemiology training program. We're part of TEFINET, which is a network of field epi training programs around the world. And we're fortunate to be part of that network where we get to contribute to helping establish standards for field epi training around the world. Next slide. So what are EIS officers? Who gets to be part of this program? Well, we're looking for exceptional, resilient, flexible, smart people coming from a variety of professions. Next slide. And this includes allied health professionals, doctoral level scientists, nurses, pharmacists, physicians, veterinarians, and a range of other professions. If you have a health-related doctoral degree or you're a nurse, you can be eligible to apply to be part of this training program. And again, if you go to our website, our eligibility criteria are very clearly laid out. But the reason why we have this is just to show you the EIS program is much more than physicians. That's how it started in 1951. But now we have an incredible breadth of professions as part of the program, and we need those professions. Public health problems are increasingly complicated, and it requires people with an incredible breadth of skills, backgrounds, and experiences. And I want to let you know, we have made significant changes to this program in recent years to ensure that everything that we do, from how we recruit and select people, it's so that we can bring in an incredible range of people with very different experiences, backgrounds, and trainings, because that helps us be better prepared to respond to the range of things that we have to respond to. Next slide. So as part of EIS, you get accepted into the program, and then ultimately you get a placement, and you can get placed at either CDC headquarters, which is that little gold star in the state of Georgia, or you could be placed at one of those other gold stars, like in Fort Collins, Colorado, or in Anchorage, Alaska. Those other gold stars are CDC's other regional facilities. So if you're not at CDC headquarters, or you're not at one of those little gold stars, you could be placed at a state or local public health department. And we currently have officers placed at all those places where you have the gold stars. The blue states is where we have officers placed, and the little green circles are where we have people at a local or county public health department. So again, you're first admitted to the program, and then later you're competing for a placement, and you have that option to either be at a CDC headquarters, a regional facility, or a state or local public health department. But one thing I just want to make clear to everyone, as part of this program, you have to be prepared to physically relocate for the program. You have to live where your assignment is. So if you're assigned to CDC headquarters, you have to live in Atlanta, Georgia. If you get assigned to Oregon, you have to live in the state of Oregon. So I just want to make clear that there are no virtual assignments for this program. It is physical relocation to your assignment. Next slide, please. So why do EIS? What makes this program so special? What makes this program special, again, number one, is the model, which is we are bringing in exceptional people. We're assigning them to supervisors, many of whom are alumni and have graduated for this program. And then we're putting you in really challenging situations where you're going to be learning and providing service at the same time. Next slide. So there is really nothing like it. There's a lot of training programs where you sit in classrooms and you do a lot of theory-based things. The overwhelming majority of your learning is happening on the job. You're going to be getting an assignment, a project, an analysis, and that is where you're going to be working with very experienced supervisors. They're going to help you complete what we call our core activities of learning. These are the things that you need to accomplish in order to graduate from our program. So whether it be a scientific publication, scientific presentation, or a field investigation, and many of these things you have one or two minimum to complete the program, but that's the minimum. We want you doing these things as many times as possible so that you're developing competency in these areas of being a field epidemiologist. Next slide. So where could EIS take you? This is truly a launching board to incredible careers for many people. Next slide. 97% of our recent graduates continue in public health related positions. So many people might come in from a clinical position, come into EIS, and they decide they really want to stick with public health. Again, that's the majority. There are some people that say, you know what, this was a great experience. I love what I learned, and this is your time to figure that out. And then they go back to what they were doing or doing something else. But the message here is that the majority of people come into this program and are really drawn to public health, love public health, and they make this their career. Next slide. EIS alumni assume key leadership roles in health departments. You can click for me, please. 34% of state epidemiologists are alumni of our program, and that's the lead epidemiologist for a state. Next click. And 45% of state public health veterinarians are alumni for our program. So these are really key leadership positions that our alumni are going on to take. Next slide. 4 of the last 13 CDC directors have been EIS alumni. Next slide. So if this interests you, if you want to come in and get training in applied epidemiology, if you want to work with experienced mentors, if you want to be of service while you're learning, then we'd really encourage you to apply to be an EIS officer. And the way you do that, next slide, is you go to that website, cdc.gov/EIS, and you're going to get down that drop-down menu. And right where you see that red circle, apply, you're going to click apply, and it's going to walk you through all the steps you need to complete to submit an application. Next slide. If you have additional questions, please email eisapplication@cdc.gov. And that's the end of the presentation. And now we're going to get to the really fun and important part. We're going to get into our Q&A with current officers. And I have this image up here on purpose because although we are a program in applied epidemiology and we want to get you out in the field as much as possible, we can never know what's going to happen in any given position or any given year. So a lot of your time may be spent sitting at a computer dealing with messy data, complex questions, trying to come up with the best available evidence for public health decision making. So yes, we promote trying to get you out into the field, but depending on what may or may not happen, you certainly can spend a lot of time sitting at a desk. And that's a critical part of learning to be a field epidemiologist, is building your analytic skills. All right, so now we're going to start into the Q&A. We have 3 officers here today that are in very different assignments with very different backgrounds and very different experiences. So you get a broad range of seeing what it might be like if you choose to apply and get selected to be an EIS officer. So the first question I have for our panel is if they could tell us a little bit about their background and about their current EIS assignment. And I'm going to go start alphabetically. And so I'm going to start with Amy. Amy, if you go ahead again, tell them a little bit about your background and your EIS assignment, please.
Hi, everyone. I'm Amy Nam. I am a PharmD MPH by training. I worked before EIS. I worked with the Indian Health Service, which is the federal agency that provides healthcare to American Indians and Alaska Natives in Arizona for several years as a clinical pharmacist. I also commissioned as a USPHS Commission Corps officer in 2019. And I was an EIS officer at the Chicago Department of Public Health. I transitioned over in February to a full-time position as a CFO, which is a career epidemiology field officer, also at CDPH.
Great. Thanks, Amy. Dennis.
Thank you, Captain Pefner. My name is Dennis Wang. I am an emergency medicine physician by training. I finished my residency up in New York City in 2023, just prior to coming down to Atlanta to join NCRD, which is the National Center for Immunization and Respiratory Diseases. Within that, I am in the coronavirus and other respiratory viruses division, which I always like to say is about 50% COVID, 40% RSV, and a mishmash of other things like metapneumovirus, rhinovirus, some Middle Eastern respiratory syndrome preparedness, and many other respiratory diseases. So that's where I am now. Like Amy, like Sana, I'm currently in my 2nd year, nearing the end of EIS, and I anticipate, if all goes smoothly, that I will be staying at CDC afterwards.
Thanks, Dennis.
My name is Sana Khan. I have a PhD in epidemiology by training, which I received in 2023 before joining EIS. And I am, like Dennis and Amy, a 2nd-year officer, finishing out my time here in Alameda County, California, which is in the Bay Area. So I've been a field officer for the past 2 years. And echoing what Dennis said, if all goes well, I would love to stay with CDC afterwards.
Great. So, you heard from Amy, Dennis, and Sana. We've got a pharmacist, an ER physician, and a PhD scientist. We got 2 people that are assigned to headquarters, or I'm sorry, 2 people in the field and 1 person at headquarters. So you're seeing the range of kind of experience that comes in and a little bit about the range of assignments. Now, starting with Amy, and then we'll go to Dennis and Sana. Could you talk a little bit about some of the projects that you worked on as an EIS officer? Thanks.
Yeah, sure. So Chicago is, the third largest city in the US. So luckily it's been very busy. We had 2 epi-aides during my EIS experience, which if you're not familiar with an epi-aide, it's typically when a local or state jurisdiction will request epidemiological assistance from CDC, and typically an EIS officer will get to lead the investigation. And so the first epi-aide was for a measles outbreak. So it was really interesting to learn, to work on an infectious disease outbreak. And then the second epi-aide was on a cluster of overdoses involving a novel adulterant in the legal drug supply. So, a little bit more of my forte as a pharmacist. So yeah, it's been a really busy 2 years. I've been able to learn a lot. Besides the 2 epi-aides, there were a bunch of other responses, smaller responses. Got to do public health surveillance at the Democratic National Convention, which was also in Chicago. That was really cool. Presented at several conferences and did some media interviews. So it's really been a crazy 2 years, but the best 2 years.
Thanks, Amy. Dennis, over to you.
So I would say that when I started EIS in July of 2023 was right when some of the first vaccines for RSV had just been approved by FDA and recommended by ACIP and then CDC to be given to older adults, to pregnant women, and for monoclonal antibodies to be given to infants and young children to prevent RSV, which is the leading cause of hospitalization in infants in the United States and kills about 100 to 300 infants in the US every year. I was not involved with that, but that happened sort of right when I started EIS. And it was incredible to see sort of CDC at the culmination of that process that also involved many partners, including FDA and clinical researchers and academicians and basic scientists before that. But then to see, my friends' parents start to receive those RSV vaccines, and for my friends who were having kids, for their infants to start receiving those monoclonal antibodies. One thing that I've been able to work on in the coronavirus and other respiratory viruses division is to look at sort of the wealth of data that CDC collects from partners and hospitals across the country to see what sorts of risk factors predispose infants and young children to really severe and potentially life-threatening RSV, to determine who should receive these products, which are, again, no product is without risk, no product is free, certainly, and to, again, be able to present those findings to people at CDC and at conferences to hopefully refine, which populations would most benefit from these products that are now available. I always tell people who are matching into a position that it's not just about picking a position, but about picking a neighborhood. One thing that I really like about being at headquarters is that in addition to the work that I've been able to do in my home program, I've also been able to work with some of the other programs in the National Center for Immunization and Respiratory Diseases. I was able to travel to Chicago to work under Amy's leadership on a measles outbreak amongst some of the migrant shelters back in the spring of 2024. I've had opportunities to travel to Colorado to investigate and to work with poultry workers who were coming down with avian influenza and to work with dairy workers who in the Central Valley of California. And so I just can't speak highly enough of sort of the opportunities and the culture that has been created around EIS to train us up to be able to do this work.
Thanks, Dennis.
I'm really happy to be last on this panel because I can co-sign everything that Dennis and Amy say because they're brilliant. But I would love to offer the local perspective a little bit because I think it's great. Dennis and Amy highlighted some of the national work that EIS does, but I'm in the field, I'm in Alameda County, and so a lot of the projects I've done are really specific to the community that I'm placed in. So a lot of work in Oakland and in the East Bay, which is a great community. So right off the bat, when I started EIS, within my first 2 weeks, I was able to investigate a cluster and outbreak of a rare bloodstream infection that was happening at an acute care hospital. And so that was really an exhilarating time and really rewarding that we were able to stop that outbreak and prioritize patient safety. So that some of my longer term projects that are not outbreak related, I was able to review missed opportunities for prevention of congenital syphilis in Alameda County. So we did a retrospective review of all of cases of congenital syphilis in the past 5 years, and we're really able to do an in-depth dive to see what was going on. And since I am a local officer and we have these partnerships with our local healthcare professionals, we were able to really connect with the hospitals and the physicians and get directly to the source and tell them where we were seeing those missed opportunities for congenital syphilis prevention. Other work I've done includes investigating outbreaks of Shigella in people experiencing homelessness and trying to stop the spread of Shigella in these encampments. So I would say the best part about being a field officer is really being able to see the impact of your work immediately when you do it. So when you're on the ground here and you're in a local area, you can just go straight to the source and really make a difference with the work you're seeing.
That's great. Thanks. So hopefully you got, for those of you watching the webinar today, got a sense of the breadth of type of experiences. And as you heard from Sana, it's really important. You also got the federal perspective at headquarters from Dennis, you got the state from Amy, and then you got the local from Sana. So the range of opportunities and the way to contribute through EIS. So to our panel, my next question is, can you tell everybody something that really surprised you or challenged you that you didn't expect from your EIS experience? And I won't pick someone here. Someone can volunteer to go first.
I'll just go ahead and start by saying that I think everybody faces different challenges during EIS. For me, I was, blessed or cursed to be in person throughout the pandemic from 2020 to 2023 when I was in emergency medicine residency. So transitioning to CDC, where a lot of the work is in the office, an environment that I wasn't used to working in, is in front of a computer and involves being a lot more organized than emergency physicians are used to being, was a transition. I am so glad that I get to work on long-term projects now, which is something you don't get to do in the emergency department, but it also requires a certain discipline that I have had to work on and continue to have to work on. As Eric mentioned at the beginning, EIS started more than 70 years ago and recruited primarily physicians. That's not the case anymore. It's, I think, maybe about a third of the folks in my class are physicians. And, I certainly came in feeling like, why would any position want a physician when the day-to-day work of being an EIS officer, like Eric said, is highly analytical, involves a lot of writing. The stuff that my colleagues like Sana, who have spent years getting their PhDs and honing those skills, are used to doing. So that it has been a challenge, but the blessing of being here too is that I'm no longer surrounded just by physicians. I'm surrounded by pharmacists and PhDs and nurses and physician associates and lawyers and economists and veterinarians. And you learn sort of where your value is, where your value could be, how you can get better, but also where you are going to have to count on the people that you work with. And I don't know, it's wonderful just being around such a diversity of people who are focused on similar but different things.
Thanks, Dennis.
Yeah, I'll definitely echo what Dennis said. You know, being a pharmacist, I kind of also had similar, you know, feelings going to EIS like, oh, you know, am I qualified enough? I don't have a lot of epi experience in comparison to PhD epis, you know, and like it was going to be my first time working at a health department. And so everything was really new. And so I think something that challenged me was just the constant feeling of being uncomfortable, right? Like it felt like the first time I was doing it. First time working at a health department, first time working on investigation, first time working on, you know, a complex analysis or whatever. And so just kind of dealing with the feelings of a little bit of imposter syndrome, right? But also recognizing like this is a training program and that you're there because you are qualified and because you're there to learn, right? You're not there because you know everything already. It's because you have, you know, the foundations of what's important, which is the passion, the drive, the willingness to learn, and that everything else will kind of like fall into place. And then, you know, as I started going, you know, and working on more things, I realized, okay, like I do have a lot of transferable skills being a pharmacist, you know, into like a lot of these investigations, for example. Like, for example, like the EPI that I led, it was a retrospective analysis, you know, going into hospitals and looking at medical records and, you know, trying to figure out how many cases of overdoses you know, that we had with this novel adulterant. And I had a lot of experience working with with EHRs as a pharmacist, right? And so like, I was able to provide that expertise. And that's not something I would have expected going into EIS. And so, yeah, I think like the fact that you have a lot of like unique different skill sets, like don't think that just because you don't have a really strong epi foundation that you are kind of behind. I think that also like sets you apart and allows you to bring in a lot of different skills and allows you to learn even more.
That's great, Amy. I'm so glad that you
Mhm.
made that point because that's exactly what we want. We want to capitalize on the expertise and skills you already have, and we want you to be uncomfortable. We want you to put yourself so you have that growth. So it's great that both you and Dennis could talk about that. Sana.
Yeah, I again co-sign everything they say. And I'll keep my answer short because they covered a lot of what I wanted to say. But just briefly, I have learned more than I thought I would learn in 2 years. I've learned an incredible amount, which sounds silly because when you think about, you know, this is a training program, so you expect to get some training, but it's also not school. I had just finished my degree, so I thought, okay, this is, you know, this is the next step. But I've learned so much. But it's not about where I've learned that information. Yes, we have the formal trainings, we have seminars and areas where we learn. But I think what's surprising to me is that I have learned so many soft skills and so much from my classmates. I can't even talk about how much I've learned from my classmates. They are a really brilliant group of people. And just from our EIS leadership and other leadership at CDC, I've learned what being a good leader looks like. A lot of EIS is emphasized on how to become a future leader in public health. And it's just these soft skills that I've been able to pick up over 2 years, how to talk to people, how to be at a table where there are federal, state, local governments and private entities and making sure everyone can have their voice heard and come to the same conclusion. So a lot of the soft skills I've learned in EIS are going to be, I think, the biggest takeaway that I've gotten from this program.
All right, thanks, Donna. So I'm going to ask one more question because we want to leave the bulk of time for all of you to ask questions. So start getting your questions ready in your brains because that's why we have this webinar, so we can make ourselves more accessible to you because not everybody knows an EIS officer, an alum. So we have these webinars to give access for everybody that wants it to get your questions answered. So my last question for our panel is, for people listening today, what advice would you have for them about applying and doing EIS?
I'll keep my answer short. If you are a medical student or veterinary student, there's the epidemiology elective program, which, if nothing changes, is offered in a couple of different sessions in the spring every year. You can apply for it. It's free. This past year, there were options to be in person or to be in person at headquarters at a couple of the state, local, or field sites, or to be virtual. I don't know exactly what format it will take in the future. That's one. There are the annual EIS conference, which is sort of the largest gathering of CDC employees and staff as a whole. It takes place in April every year and is open to the public. There's no cost to attend. It's a great place to meet EIS officers. Even if you don't end up doing EIS in the future, we welcome you as partners in this public health work. And the last thing I'll say is, I think if you do decide to apply to EIS, people will expect you to have demonstrated an interest and a commitment in public health, but people don't expect you to know exactly what you want to be doing in public health 20 years from now. They don't expect you to have all the answers. It's a training program. So you know, if you're committed to that career in public health, start now, and then join us.
Thanks, Dennis. So again, you know, he just talked about if you're a medical or veterinary student, it's a great opportunity. You can do a rotation at CDC, and that's another program that we offer in our branch. Again, that's the epidemiology elective program. So go ahead and Google that or put it into whatever browser you use and check that out. It's a great opportunity to get some exposure and see if public health is something that interests you. And again, please check out our cdc.gov/EIS website with information about the conference, because as Dennis pointed out, it's accessible to everyone. If you want to come, there's no registration fee. If you can't physically get to Atlanta to come, you can watch all the sessions virtually online when you register too. So we've added that in recent years again to make the conference more accessible to everyone. So, all right, who wants to go next, Amy or Sana?
Yeah, I will say my advice when doing the application would be don't try to write what you think they want to hear or force yourself into some mold of a preconceived notion of what you think an EIS officer is. Just be yourself and to myself. It'll come across well, but we have folks from all different backgrounds. You know, we have entomologists, veterinarians, and it would be a disservice to you and to the program if you tried to write an application that you think is, you know, something that EIS is looking for, because really our class is made up of folks from a lot of different backgrounds and life experiences and people that had really long careers before this and transition. So there's a lot of different paths to get here. So I would just say, tell your story and be genuine, and hopefully that will come across in your application.
Yeah, I think so. My advice for both applying and during EIS is to just stay open-minded and flexible. You know, when I was applying to EIS, I thought that I was going to go to headquarters and I was going to move to Atlanta, and that was the plan because that's where I wanted to work post EIS. And then I got in, and then I talked to some people, you know, Eric, and learned about the field positions, and then I realized, wait a minute, this sounds really interesting, and like I'd be able to work on a lot more different, you know, a lot of different topic matters. Like I'm not really interested in like one particular, you know, topic matter yet, and I'd be able to kind of work a little bit closer to the community. So after learning more about it, I realized, yeah, I definitely want a field position, and you know, ranked a bunch of field positions. Did not get my first choice, which I was bummed about, but honestly, now I am so glad I ended up with where I am, because, you know, like you may not get what you want, but you get what you need. And I'm, you know, if I wasn't here, I wouldn't have been able to get the opportunities that I got. I wouldn't have been able to get this position, you know, to stay here in Chicago. I love Chicago. So it kind of worked out in the end. And so I guess like the whole point is you may come in like with a really specific idea of what you want to get out of the program, and you may leave with something that is completely different, but may end up being better than what you expected.
Great. Thanks, Amy, Dennis, and Sana, for, you know, making yourselves vulnerable and talking about those things. We really appreciate it. Now let's get into the Q&A. The first couple I'm going to knock out for me, and then we've got one for the three of you. The first one is about the public health service. So you can see that Amy, Dennis, and myself are all in the public health service. And it used to be that when you were applying to EIS, you could apply to either be commissioned in the U.S. Public Health Service or come in as a fellow. And that's changed. Now everybody comes in through the fellowship mechanism, and we're working to make it so that you can be commissioned in the U.S. Public Health Service as you graduate. But that's still being worked on. So right now, it's not an option to come in as USPHS. Everybody comes in the same as a fellow. The next question is about the acceptance to the program. How competitive is this? This program is so highly competitive and classified, I can't even tell you that. But what I can tell you is that we do get a lot of applications, and we tend to get around 400 to 500 a year. And we accept the number based on our funds for a particular class. Right now, our last 2 classes, we've selected 50 per class. So you can do the quick math on there and get a sense of how competitive it is. And the next question is, we got someone who's working on a PhD in biological anthropology. What skills and experience would you recommend seeking out to be competitive? What makes a standout application? Well, Sana told you one thing, tell us about yourself. Why is it that you want this training? What do you bring to it, and what do you hope to get out of it? And know that everybody applying to this program has accomplished a lot academically. You're all highly successful. You're probably in that top 1% of academic achievers. So then we're looking for those other things. We want to hear about what you're bringing and what you really be, as specific as you can be, what you hope to gain from this program. All right. So now for the panel, can you touch on the benefits and considerations around matching at headquarters versus the field?
Yeah, I can start. I think Amy just said this in her last answer too. When you go into the match, like you thought, you can think, oh, well, I really want to be at headquarters, or I really want to do this, but remain flexible because you never know what's going to be calling to you. That happened to me too. The benefit, I think, and I'll let Dennis speak a little bit more about this, for being at headquarters is you get to work with a lot of larger data sets, a lot of national issues that come up. You definitely get to speak with people, on a higher level. So I'll let Dennis talk about that. But for me, for the field, I love being at the local health department because, I feel like I really get to connect with the community that this health department is a part of. And so I would say, for when you're considering whether a headquarters place is for you versus a field position, maybe consider what kind of projects are you interested in? What does it look like? What do you want to do in your career? And then the last thing I'll say is, if you're like me and have your attention pulled in a bunch of different directions, if you're in the field, you're really able to take on projects that are in a couple of different subject matters. So you can do a chronic disease, infectious disease, outbreaks. So you can work on it all in the field, versus if you're in headquarters, you'll match to a very specific subject matter. And you can do, you can become the subject matter expert in that place. But I would say it's really nice to be able to work on a variety of things because, yeah, I don't know exactly what I want to do for the rest of my life. So it's great to get to work on a bunch of different things all at once.
Yeah, I'll tag on
So
to what
just
Sana.
go ahead.
Okay, I was going to tag on to what Sana just said. So yeah, besides like the breadth of experiences, I also think, and I don't know, I'm very biased towards field positions. I think that being in the field, especially if you're at a local jurisdiction, you get a lot of chances, or you may get a lot of chances to do more outbreak investigations, right? Especially if it's a non-centralized, basically if there's no state that is, centralized to be in charge of all investigations, like typically the local jurisdictions will have priority. And so being at the city, for example, allows me to work on any investigations that happen in Chicago, as opposed to being, for example, at Illinois, which there is no position in Illinois. But if I was at the state, it would kind of fall into Chicago's jurisdiction if there's anything in Chicago. So I feel like you may get more outbreak investigation opportunities than the field potentially. I also think you kind of can get like really cool shadowing opportunities. I'm sure you can get really cool shadowing opportunities at the headquarters as well. But I've been able to go on like a lead inspection visit, or go to a nursing home and do like a point prevalence survey, or tour the emergency preparedness warehouse. Like random things like that within the city city, I think are really cool. So yeah, some of the benefits of the field position, but the headquarters positions definitely have benefits too, which I'll let Dennis speak on.
So I want to start off by saying that some of my most memorable experiences, let me see if I'm frozen. I'm not. Okay. Some of my most memorable experiences have been in the field, working with people like Amy and with some of the other field officers. So there are opportunities for headquarters folks to get out in the field as well and to interact with your field colleagues. But if you're in the field, you're already there. So there's certainly that. I know that Eric mentioned earlier opportunities for EPI-AIDS. So EPI-AIDS basically are requests for technical or field assistance from state, local, territorial, tribal jurisdictions. And opportunities for EPI-AIDS go in large part to EIS officers, and can go to either headquarters or field officers. I think everybody from EIS leadership, like Eric, down to our individual supervisors, are interested in us having diverse experiences. So at headquarters, that may look like opportunities for you to work on topic areas that are not directly in your supervisor's team or branch or division. For me personally, I was a bit of a generalist, as emergency physicians are, and I wanted to dive into one area a little bit deeper. Separately from that, temperamentally, I knew that I would be moving to a new city for EIS, and that I wanted to have a group of colleagues, co-fellows, sort of built into that experience. And that is one thing that I think is a little bit easier at headquarters than it is at the state or local sites where you may be the only fellow. There are dozens of us in Atlanta. But all that being said, we are all great friends, state and headquarters folks. Amy, Sana, and I all went to Puerto Rico with another 24 of our co-fellows after the last EIS conference to Puerto Rico for a couple of days just to relax. And yeah, the people really are the best part of the fellowship. And so I think I get a little bit more of the interaction with the co-fellows than do the state and local folks.
Great. Thanks, Amy. So you kind of get the sense, again, Amy's at the city. I think I said state earlier. So she's at the city, Sana's at the county, and Dennis is at headquarters. So you get that. It's very different. If you come to headquarters, you're much more likely to become very specialized in a particular area. And as one of our leaders used to say, the field positions that Amy and Sana is like the emergency room of public health. Every day you might be working on something different based on what the crisis is at that moment, because you are you're closer to the action. So that's some of the main differences. And as Dennis also pointed out, you've got that closer interaction physically with your cohort, but the field officers are also very close. They have all their virtual communication tools, they get together. And so it's a different type of bonding, and it's really deciding what feels best for you. We've got a number of questions in the QA about eligibility. And again, all of those, just go to our website. It's very clear what you need to be eligible based on your backgrounds, and you'll get your answers there. If you still have questions, we've got that EIS applications at cdc.gov, and they can get back to you. So someone asked about the map. They said, our experience is limited to the states that were colored on the map. No. On every given year, we have the states or local health departments or city health departments that are recruiting for an EIS officer. Sometimes if a particular city or county or state has an officer, a first year, who's going to become a second year, they're not recruiting for another officer. Some states like California have a bunch of officers, so it just depends. So every given year, the states that are recruiting for an officer changes. And then we go through the process of interviewing and matching to those. And some will match and some will not. And that's why we don't have an officer in every state, because we don't have enough officers to put there.
And we have a related question, Eric.
Yeah.
It says, should you not apply to EIS if you have a strong location preference? Can you comment on that?
Yes. If you are limited in geography, saying I really only can be in California or Texas, this is not the program for you. Again, you have to be prepared to physically relocate to your assignment. And we can guarantee pretty much anybody that gets into EIS, we can get you a position in Atlanta. So you have to, at a minimum, be willing to relocate to Atlanta. But then if you're open and willing to come to these other places, depending on the states that are offering a position, you have the opportunity to go there. But you have to be, you can't, this is not a program if you're very limited to 1, 2, or 3 states, because we can't guarantee that you match there. Thanks, Rocky, for bringing up. That's a really important point. All right.
I see another interesting one here. How would you say your educational background supports your work as an EIS officer? Did you need to match with a position related to your educational background, or are you doing something new and different?
My whole team are physicians. They're physicians and nurses, and I have a background I have a PhD in epi, and so I have learned a lot from them. I would say that, yeah, I think the answer to that is clear. You don't have to match into a position that is very closely aligned with your background.
Yeah, I was just going to say the same thing. New and different, definitely. Definitely the only pharmacist on my team, didn't come in with a lot of experience on the subject matter, and you just learn on the job.
I think some people do come in with a slight preference for continuing to work on a similar area that they've worked on before during their PhDs, for example, and then some people want something completely different. And I think that when positions are looking for incoming EIS officers to match with, they generally, with a few maybe very limited exceptions, all of the other positions will be pretty open to just seeing what is a good fit as far as personality and team dynamics, without regard for your personal sort of educational experiences in a particular subject area.
Great, thanks. And I think an important point for me to clarify is, as a reminder, you apply to this program, you have the online application. Then from the online application, we choose a select group for interviews that are done virtually. After the interviews, based on your rank scores that come from the combination of your application score and your interview score, we have a cutoff line, and then whoever falls above that cutoff line gets selected for the program. Once you're selected for the program, that's when we then have a matching process where we have the range of positions that are available, and we have a select prioritized group that you can pre-match to around the November before the start of your class. And for those people that don't do that, everybody else comes to EIS conference, and at the conference, we have all the positions that are there recruiting. You spend the week getting to know them. At the end of the week, you go ahead and interview from anywhere from 7 to or more positions. You rank them, they rate you, and then we have an algorithm that matches people, and that's how you get your assignment. So we've got a question here. What do we recommend for a master's level epidemiologist interested in a future EIS? So number one is, again, you need to either be a nurse or a doctoral degree to be eligible. So first thing is, enjoy practicing epidemiology with your master's, and then decide, do you need that higher level degree to do something that you want to do in your career? If you're happy, there's a ton of great master's level epidemiologists at health departments, at CDC, and other organizations. But if there's something that's still you feeling you want to do more, you decide what is that next degree you want to get, you go get it. But in the meantime, something that you are eligible for with the master's level is we have something that we fund through the Council of State and Territorial Epidemiologists. It's called the Applied Epidemiology Fellowship. So if you go to CSD's website, the Applied Epidemiology Fellowship is 1 or usually 2 years, and you also get placed at a state or local health department. And a lot of those fellows work closely with their EIS officers. So we had a question here for a PhD scientist. So Sana, that would be you. How did your academic career prepare you for EIS? And if you could talk a little bit more about, they're asking about your experience.
Yeah, I think my academic experience was a little bit unique because I started my PhD right at the beginning of the pandemic. And so I actually wanted to get a PhD in something like I wanted to study antibiotic resistance on the US-Mexico border, and then COVID happened, and it was all hands on deck situation. And so I think my PhD really prepared me for EIS because I got a little bit of a taste of what it was like to work in an emergency situation. And the reason I wanted to apply to EIS, I hadn't considered it. I decided very last minute to apply at the very end of my PhD. And it was because I was enjoying the field work that I was doing so much. I loved being at our vaccine pod every day. We set up just this giant vaccine drive-through at the University of Arizona where I was at. And I just loved that, being part of a EOC and being part of a response. So I think my academic experience was a little bit unique in preparing me for EIS in that sense. But the other skills I'll say that are more traditional that you use when you're getting your PhD, learning how to communicate and write manuscripts and doing data analyses are really important. I feel very fortunate to work with a lot of clinicians that can fill in the gaps that I don't have. But what I bring to the table with my PhD in EPI is a lot of knowledge on proper study design, on creating data extraction tools, on how to do picking which statistical analysis to use. And so it really is about being on a diverse team. And I think that my academic experience prepared me in both of those ways for EIS. And just want to reiterate, you'll learn so much on the job too. Like you don't come in here thinking that you need to be fully cooked and done. You'll learn on the job. Absolutely. Whatever your background or experience is, you'll pick it up. It's really just, about wanting to learn like while you're in EIS.
Thanks, Hannah. There's the question about is EIS primarily for those with a background in infectious disease? So historically, we've had positions at CDC in chronic disease, environmental health, injuries, occupational health, and infectious diseases. Going forward, we're still waiting to see that the secretary has said that he'd like CDC to be more prioritized on focused on infectious disease. And we're still waiting to see what, if any, organizational changes may be happening at CDC. So we may become more focused on infectious disease, but you do not have to have a background in infectious diseases to do EIS. Prior to doing EIS, I was exclusively almost focused on chronic disease prevention, and I ended up matched to global tuberculosis and HIV, and that's what I did during EIS and for more than a decade after. So this could be a great opportunity to pivot in your careers as well. Someone asked about if they've been in practice for 5 to 6 years. Does that hurt their chances? No. We have people coming straight out of training programs. We have some people that have been working on their careers for 10 years or more. This is about, in your application, making clear why you want to do EIS, what you can get out of it, and what you can offer. So not having as much experience or a ton of experience, that is going to influence it. There's a question. Yeah.
There was a question, someone was asking about the experience of nurses in EIS and typically what they work on.
Sure. So nurses get to work on the same thing as everybody else. I'm sorry we don't have a nurse on this panel. We wanted to have a range of professional backgrounds and we couldn't get them all as part of the panel, but everybody can have the opportunity to work on anything. There's no limitation if you don't have something. Now, sometimes we do have a request for an EPI or a particular project where they want a particular skill set. They want someone that can do ArcGIS mapping. So someone that has that skill is more likely is going to get that project. Sometimes you do have something where you have to take specimen samples. So in that case, we're going to prioritize our clinicians, which could be the veterinarians or the physicians. Sometimes we need someone where they say we have to have someone who understands drug interactions, and that's where someone like Amy is going to get prioritized over other people. So there's sometimes that your skill set will lead to what opportunities you might get during EIS specific, but as far as coming into EIS, that's not going to limit you. And we have had nurses do incredible things in EIS. All right,
and
Alexia?
I think we have enough time for about 1 or 2 more questions.
Here.
I have a question here. If accepted, are you expected to move only once, and that would be at the beginning of the fellowship, or could you be asked to move midway through the program as well? And kind of related, are there opportunities to work on global health projects, or is this only domestic?
So you're only asked to move once for the start of the program. If it has not happened since I've been chief of the program in 8 years, that something so drastic happened that we had to move someone from one location to another for a position change, that has not happened for me. So generally, you just move once. There is the possibility if something really bad happened to your position, that we'd have to relocate you to a different position, then you might have to, and that would have to be worked out. But again, that has not happened in my 8 years. Any of you want to talk about global work?
I mean, I don't have any experience doing it, but our classmates have done really, really cool global work. Like a couple of them have traveled to a lot of different locations. You know, like I'm thinking of like Megan and Italo and everything that they've been doing, but really cool field work. I can't speak exactly to their experiences. I don't want to speak for them, but I know that they've had a blast and they've really been supporting their teams wherever they need to go. I will say when you're matching, there's like in the position descriptions, you'll get a sense of how much global versus or international versus local travel there is. They'll give you a percentage and say, in this position, your global travel will be like 20% or it'll be 0%. And I will say if the EIS conference materials are still available, you can look through the abstracts and see some of the projects that our classmates have been able to do. I think they might still be online, but really cool stuff. A lot of different countries that our classmates have been able to go to and doing a lot of meaningful work.
Yeah, and we're getting ready to deploy some of our officers to help with the MPOX response in several countries in Africa. So we have a number of our officers that deploy for responses, and then we have a number of global projects. And again, I was an officer in a global group as well. So there is a mix of global and domestic work. And again, as just mentioned, if you go onto the CDC, our EIS website, cdc.gov/EIS, and you search for conference, if you click on the conference and you go ahead and register, you can get access to all the content from the recently completed conference. So, all right, Alexia, over to you.
All right, so we are in the final 2 minutes of our webinar time. Thank you so much, Eric, for moderating, and thank you to our panelists for sharing all of your amazing experience in the EIS program. We hope for all of those attending that you now have an interest and that you've learned more about the EIS program. Typically, we do a post-webinar survey, and we have it in poll form this time. So I'm going to launch that now. And on your screens, you should see a set of 4 polls for you to answer before the end of our webinar. This is for us to get some feedback on your experience here listening from our panelists. This really does help us improve these webinars so that we're getting the best information out to all of you. Now, I hate that we didn't have time to answer everybody's questions. As Eric has mentioned, there is a lot of information on our website, particularly for those of you who are asking about eligibility. We have a very extensive description of what eligibility looks like on our website. So please go check that out. We do also have, I know there were a lot of folks asking questions about the application process. There is an on-demand application-focused webinar that can also be found on our website. So definitely go check that out. And with that, we have 1 more minute for everyone to fill out this poll. Thank you again for coming. If you have additional questions that were not answered here, that cannot be answered on the website's information, you can certainly email us at that EIS applications@cdc.gov email. Right? And that concludes our session. Thank you, everyone.
Thank you.
All right. I'll give it 1 more minute for folks who are still answering that poll, and then we'll end the event.